If you're a healthcare practitioner and you see your patients in person, so you serve a local area and you're an in-person provider, you're going to want to pay attention to this, because this is some things that you can do to get more out of your marketing and get in front of more of your ideal patients. Hey there, I'm Dr. Ginger Bratzel from gingerbratzel.com, and I work with private practice healthcare providers to get and keep all the patients they need. And so this is what I want to share with you. Growing your practice and using your marketing plan to propel your practice is a little different if you're a local marketer, and that's good news for you. You have a designated area that you're serving, but how do you get it out to people? How do you get them to understand where you are? Now, most of the time, people are just spreading it out there and hoping it comes, and you might be in that situation, and here's the reason why it doesn't work. You want to get in front of the right people. Now, social media allows you to do it, but if you're doing social media and just kind of haphazardly doing it without a plan or a action, you're not going to get the results you want. You want a strategy that gets you in front of more of your ideal patients. So there's two things you need to be doing. Number one is using social media with an ad plan. For as little as $5 a day, you can get in front of your ideal patient, and with the right strategy, call them into the office, get them in as a patient, a client. And number two, you need to be using more video. Video with a script that tells you what to say, when to say, and a particular call to action. And in case you don't know it, this is what call to action means. That brings them in. We don't want them just seeing your stuff. We want to build a relationship. So with social media, there's people watching out there, but they're not coming in, and you don't know who they are. You don't know where they are. But if you have this plan in place, we can keep getting in front of them. We can help you get in front of more of those people, because it takes more than one interaction for them to say yes to coming in. Research shows us it used to be 4 or 5. Now it's more like 60. We want them to have several positive interactions, and we can leverage social media to do that. Let me walk you through it. I have a resource that will kind of is a video walkthrough of this whole strategy, how you can implement it in your office, again, for as little as $5 a day, to get in front of your ideal patient and a prospect and client, to keep getting in front of them until they come in. And so you're not wasting your time with social media. You're not just putting cutesy wootsy stuff out there. You're getting stuff that actually works. And that's where people mess up on social media. So you're in that unique position as a local provider. If you put down in the comments or send me a DM and put the word local in it, I will know what you're asking for, and I will send over that walkthrough plan that I did for another client and kind of give you the big scope on it. You will find it very insightful and resourceful. It doesn't have to be confusing. It doesn't have to be a guesswork, and you don't have to waste your time. Don't do any marketing unless you have an end result ready to go. I want you to have that resource. So just comment down below or send me a DM with the word local so I can get that to you, and you can start using it for your practice in your area.